Our final plenary topic is called Abandonment at 18, Pitfalls of Transition. We have a very special guest today. An individual, Jeremy Harvey, is 31 years old, and from the age of 4 until adulthood, he was in foster care. During that time, he lived in approximately 7 different placements, ranging from foster homes to residential group home settings to mental institutions, and he even experienced homelessness. In spite of long-term involvement with the child welfare system, he has been successful. He first attended Northern Illinois University on the DCFS scholarship, and then later Loyola University, attaining his postgraduate certification with honors in paralegal services. Jeremy's unique experiences in foster care help him bring awareness to issues plaguing foster children. He has been there. He currently works closely with the Youth Advisory Council, helping to empower youth in foster care to take charge of their lives and take responsibility over their future. Please welcome Jeremy Harvey.
All right, well, thank you guys so much. I'm your closer today, so welcome to the final plenary session titled Pitfalls of Transition out of foster care at the age of 18. To start, I've got nothing to disclose. So my name's Jeremy Harvey. I'm a liaison from Foster Care Alumni of America, and I spent 20 years in foster care. That's 7,300 days. And like so many other youth in foster care, my transition to adulthood seems set up to guide me to failure. My plans for adulthood, they failed more times than I could count. But had there been better planning, earlier interventions, better long-term supports, my transition to adulthood would have been much smoother. Let's start today by talking about what your role is. As pediatricians, you get to monitor the physical health of youth, helping ensure that we get to become healthy adults. But there's so much more to consider than weights, temperatures, and pulses. What we're all really trying to find out about is well-being. You can impact my well-being just by taking an interest in me and just by asking a couple of extra questions. Let's start with a couple of numbers here. 2013 data shows that there's approximately 402,000 children in foster care across the United States. That same year, 238,000 young people exited foster care. Unfortunately, 23,000 of them aged out at the age of 18. To put that number into perspective a little bit, that's more than the number of students who start first-year medical school across the United States. And when our cases close, we lose access to financial supports, services, housing. For 23,000 young people, that was their 18th birthday. How many of you guys in the audience today have teenagers? All right, or maybe work with teenagers? All right, there's a couple of you guys. All right, congrats. Can you imagine your teenager, the teenager that you work with, being ready for all the challenges of adulthood at 18? Could they do it without a support system or without a safety net? My life before I came into foster care was really nothing short of terrible. But my life while I was in the system wasn't much better. I had 7 foster homes, I went to 2 high schools, I struggled with homelessness, and I experienced a multitude of new traumas. And that was growing up for me. That was what foster care was like. But I was lucky. I grew up in Illinois. And in Illinois, we believe in extending foster care beyond the age of 18. It's more the standard. Professionals and judges believe that young people need those types of supports. Illinois also incentivizes our performance. If we engage in higher education, college, or vocational school, we can continue to receive financial supports until our 23rd birthday. Unfortunately, even with all these supports, as I approached my own case closure, I sort of thrust into adulthood without somebody to guide me through it. As doctors and pediatricians, you already know, foster children, we don't always get a great example of what healthy relationships are. So as a person that's invested in my life, as a person who I might trust and rely on, ask me, who can I trust? Who do I turn to if something went wrong? And though you might not know who my caseworker or my social worker, understand who I might turn to, how to use the existing supports I have, and show me that you have an interest in me as a whole person. Understand that you might be the only person asking me any of these sorts of questions. I think that there are quite a few opportunities for foster care to get better, but one of the first ones I want to talk about today is that every child welfare system needs a dedicated pediatrician as their medical director. Who better knows how to take care of us and how to meet our immediate and unique needs than you guys? Today, I'm going to highlight 5 key areas I think that foster care can improve beyond that one. Number 1, help young people develop and nurture social capital. The second one's going to be rebuilding and repairing biological relationships. If there's no family, we need to teach our young people interdependence and independence much earlier. Child welfare should support us well beyond 18, and we really need to start thinking about supporting our young people until the age of 25, an age where independence is more attainable. And finally, that child welfare needs to immediately start making youth-driven transition plans for what life's gonna be like after foster care and maybe we're all gone. And we need to start much earlier. So, without further ado, what is social capital? I like stories. So 18-year-old Jeremy decided he wants to drive from Chicago to Maryland. I got onto the Pennsylvania Turnpike with a quarter tank of gas, and I quickly realized there are not many exits. I broke down on the side of the road and ran out of gas. For me, social capital was who I turned to next. Well, I ended up calling my foster parent with a simple question of, what do I do? Social capital is who we all might turn to for support and guidance. For those of you that said that you had teens or new teens, think about all the supports that they need, from cell phones to books, clothes, and most importantly, they need our guidance. Some of you might be young enough to have 20 or 30-year-old children, and we gotta think all the supports that we still continue to offer them throughout their life, especially guidance, right? And this is what we talk about when we think about developing social capital. Dr. Bruce Perry said it best, the more healthy relationships the child has, the more likely he or she will recover from trauma and thrive. Relationships are the agents of change, and the most powerful therapy is human love. Since far too often, foster care systems leave young people with no relationships, change is necessary. We all need to help young people reconnect, rebuild, and repair relationships with biological family. For me, entering foster care meant that I lost my biological family. I also lost contact with 2 biological brothers. Chapin Hall's data would show you that 25% of our young people are returning back to biological parents after their cases close. An additional 33% are returning back to some other type of biological family. Regardless of how easy it is for them to ask to stay there, how healthy it is to live in that environment, how long we can stay there, or the history that you might have with those people, ultimately, it's still family. We need to help our young people explore these relationships while they still have our support. That way, if things go wrong, if families need extra supports, we can step in. We can be that additional safety net. Unfortunately, I have to accept there's going to be some situations where no positive family can be found. For these young people, the system has a much harder challenge. Youth need to be taught interdependence. This is how to trust people, how to rely on others, how to meet your long-term and short-term needs. These are skills that you need for long-term success. And traditional families teach their young people these things without even trying. All right? You might think chores equal an allowance. This teaches young people an understanding of budgeting and builds a work ethic. Conflict in a family might equal conflict resolution. We teach our young people how to overcome the adversity and problems. All too often, youth in foster care don't learn these essential life skills. I can tell you that firsthand because I was in foster care, that more than once a conflict with a parent resulted in my possessions in hefty bags rather than conflict resolution. Let's think about that for a moment. Young people in foster care are faced with that reality. Conflict can result in real loss of supports and access to family. Unfortunately, too many of our young people lack social capital. They lack biological family. They aren't taught these necessary life skills. What can you do about it? Well, I challenge you all. You can become a mentor or become an advocate. There's a real shortage of mentors across the United States for at-risk young people. And it is a well-known fact that people that work as professionals with young people make excellent mentors. I recognize that between seeing patients and all the other work that you might be doing, it can be difficult to carve out additional time to actually step up as a mentor. Consider this though, I was lucky to get a mentor. He helped me focus on my future. He helped me stay on a good path. And I am lucky to still have a really close relationship with him, even after 15 years. If you can't be my mentor, at least know where you might be able to refer me to for these types of supports and services. It is one way that you can instantly impact the lives of at-risk patients, and especially youth in foster care. You can also be a more informal mentor. Think, a simple phone call to me between a visit, a follow-up email, just consistently engaging me. These are informal types of mentoring. Unfortunately, my life was plagued with many new people. It would have been nice to have a little bit of consistency. Being my advocate is another opportunity. Ask me about my future plans and follow up on what that plan was. Show me that somebody is following up with me and that they might actually care, simply by asking again and again. All right? You might be the only person in my life really considering these things. Over the last several years, we've made great progress in the U.S. There are new laws, regulations, and public policies that extend foster care beyond the age of 18. 44 states offer support beyond the age of 20. This is great progress. But there's so much more work to be done. 26 states currently don't draw down federal matching dollars to support extended foster care. This unfortunately puts young people at risk to state budgetary issues and discretion. We should encourage our states to maximize their funding pool and draw down these types of federal supports to support extending foster care beyond the age of 18, beyond the age of 20. And I would challenge you, if so many states are extending foster care beyond the age of 18, if we think about that first statistic, 23,000 aged out, well, how did that happen? Today is not the time, but it begs for our consideration and our contemplation and our future planning. It's just one of the reasons that I want to encourage you all to connect with your local AAP state chapters, your local foster care alumni organizations, and your local policymakers. Help ensure that youth have access to all the types of supports and services they need to be truly independent. I believe that we all need to start thinking about how the systems can be starting to serve young people well beyond the 21st birthday. States should support young people in a different way, but support us until 25. This is a more realistic age to achieve true independence and support the most vulnerable of our populations. Consider that just by extending foster care from 18 to 21, we have marked increases in education, higher levels of employment, lower levels of incarceration. To me, that sounds like improved well-being. What type of outcomes could we achieve if we continue to offer those types of supports until 25? Regardless of when states and systems begin to age young people out of foster care, they need to start talking to us about our transition plans. And these should start on the very first day that my case comes into foster care, planning for the day that we won't be here as a system and where we won't be around. Without better case planning and earlier intervention, we're unfortunately doomed to continue the current trend, that 60% of our housing plans will fail within the first year of leaving foster care. Without great supports, without good planning, or even lifelong connections, can we really be surprised by that statistic? And when our housing plans fail, we turn to couch surfing. And it's not this picture that you see on the left. It's the unfortunate it skipped a slide there. It's the unfortunate reality that we see on the right here, where we bounce from couch to couch exhausting our options and quickly ending up on the streets. How many youth does this happen to? Well, Chapin Hall's data suggests that it's 4 in 10 young people. If we took that first figure where 23,000 people are aging out at 18, that's 9,200 new homeless youth each year. That's more than the entire undergraduate population of Georgetown University. There's another opportunity to make sure that we're helping our young people. It's that no wrong door, the one-stop shop, the medical home. Be my continuous and comprehensive support, helping me find access to resources to succeed. This includes local and national opportunities such as food banks, local clinics, local job programs, but know these resources that I can call. And better than that, don't just know a name and a number, actually know where you're sending me. Make sure that you're sending me to the right place the first time. And then follow up, ask me how it went. This is essential engagement with the young people. Thankfully, the AAP continues to dedicate time and resources to look at how we serve young people in foster care, developing powerful pieces like the Resiliency Project. And another great project by the late Dr. Tom Tonages was written with youth on the topic of managing their health care for the very first time. It's a comprehensive list of essential documents and questions to ask. You can find this on your own website. It's a really great document. Let us review some of the interventions that we've talked about so far, though. States and counties need a pediatrician as a dedicated medical director. We need to support young people staying in care beyond the age of 21 and continue to push for the age of 25. Become my mentor or step up as my advocate. Understand how your state or your local county pays for extending foster care. Ask me about my long-term plans for independence. And be my one-stop shop or my no wrong door or my medical home. Before I leave today, I'm going to give you 3 more ways that you can impact my life. All right, ask me if I have essential documents like an ID, a birth certificate, a social security card. While I don't expect that you might be able to take me to these places, understanding who my resources are and how to get access to these documents is essential as I think about independence. Try to ensure that I have prescriptions for 3, 6, or 12 months after my case is about to close. This really helps me bridge the gap between you and my next care provider. It can be kind of difficult if you're moving frequently, if you have to move into a new community to find a new provider, and a simple solution like this means I have essential medications for longer. And finally, help me ensure that I get a copy of my medical records before my case closes. This is easy. Put them on a jump drive for me. Right? This is essential because if I'm accessing adult systems, one of the first questions they're going to ask me is, where are your medical records? Let me see them. Having them and making sure I get a copy of them before my case closes only makes my life easier as I transition into my own adulthood. I wanted to thank you all today for your time and for your commitment to foster children. I want to thank you for all the work that you have already done and for all the work that you're going to do in the future. For more information about how to get involved or to get more information, please check out your own website, or you can reach out to Foster Care Alumni of America. I've included their website. You can reach us at fostercare@aap.org. You can call me directly on my cell phone. These are all opportunities. And I really want to thank you all today for continuing to dedicate your lives to young people and to our most at risk. So thank you. Oh.